I want to get straight into a specific term, which I think recently I've been speaking to a lot of people about, and I had this at a conference I went to last week as well, which is the word omnichannel. And I think, Yasin, you have this in your job title. So I just want to throw it to you almost, first of all. What do you feel about this word? Are you still using it? And what does that mean to you? Because context to that question as well. So recently, when I've been speaking to people, they kind of said that feel like that word is a bit taboo and they're no longer wanting to mention it. It's more like customer engagement, for example, and they're kind of referring to it as the O word. So yeah, what are your thoughts on that?
Well, unfortunately, I share that feeling. It's a word I'm not particularly fond of. I would even say I hate it at times because there's a very big misconception about what omnichannel is. So I very often also refer to myself or to what I do as a customer engagement lead or customer engagement, because that's what it's about. If then you achieve it through multi-channel, omnichannel, or even single channel, for me, the focus is on message delivery. And recently, a colleague even called me a postman for that, because my obsession is on getting the message to the customer. And actually, that also then ties to my mission, because my mission is to get that message to the customer. Why? Because we want HCPs to make the most informed prescribing decision possible. If we don't do that, if one day I'm a patient or my mom or whoever in my vicinity, I want them to get the treatment that is most fit for purpose, not the one of the loudest shouter or the one with the biggest booth. It's about the HCP being armed to make the most informed prescribing decision. And then however you get that message across is actually what matters. And that's why with omnichannel, actually, the fact that even channel is in the word is something wrong, because you start focusing on the channel already instead of the message. So that's a bit where I stand around that word.
Yeah, I love that. And I remember, I think you posted something a while ago, and we got into a bit of a debate around kind of channel message formats and all of that as well. So we can definitely dive into that a bit when we talk about content. And same question to you, but also an add-on, because I think you sparked a debate recently around kind of competencies versus having these omni-channel functions in terms of having those competencies in all roles within the pharma company. So it'd be great to kind of get your thoughts and maybe kind of elaborate on what you meant by some of that.
Yeah, so I mean, I echo what Yasin said and what you said, but I think I don't like the word is taboo for me, and but we all use it, right? Because I'll probably on our agency website it will say that we can do omni-channel, because that's what everyone wants, and we do in a job as well. You have an internal persona to sell, and omni-channel is popular and required, so you do it, right? But I like that you said, Yasin, it's the word channel, and I couldn't figure out what it is that I don't like about it. But I think that is what it is. What it comes down to is people then focus on, it's all about connected lots of channels, it's all about the channels, and it doesn't really matter. For me, you shouldn't be aiming for an omni-channel excellence. You should be aiming for a goal. And if the goal is to ensure that each healthcare professional understands enough information about your product in order to use it in the correct situation, then there are loads of different techniques and tools. It could be one channel, could be specific channels, could be specific types of content. It's all about your kind of strategy and engagement. So again, I feel like the focus on omnichannel means that you just then focus on trying to understand what that is rather than the actual impact or the customer need that you're trying to address. So for me, yeah, I find it difficult. On the skill gap, I think that's very closely tied to this idea of omnichannel. So I did a post recently about, well, it came from the fact that a lot of people who I see in omnichannel roles, like Yasin, they're the ones that have this idea that we need to be a bit more customer first, and they maybe have a little bit more understanding, whether it's because of the background or the type of people that get hired into the role, they have a bit more understanding of what it means to actually create a practical marketing ecosystem, which channels to use, what content will resonate, compared with your traditional pharma brand manager or marketing team, where the focus is very much, well, this is our creative, these are our core messages, and we always do these assets. So my role is to make sure that I can communicate as often and as far as possible about what my product does. And I think that this is the difference. I see that these people in the omnichannel roles end up not actually trying to orchestrate omnichannel within the business. What they take up, they spend all their time basically sort of trying to sort out really basic things like, okay, here's how to do an email structure. Like, here's how to do a basic welcome journey of 3 emails when someone subscribes to your website. Here's a sort of form that you might put into your website that helps you generate leads. Here's how to make this message more customer centric. So they end up basically just teaching basic marketing to brand managers. And so that's my issue with the fact that we've introduced it as a role. And it means that what you end up is you've actually effectively trying to solve an engagement problem by introducing a role rather than inherently changing the way that the company and brand teams do things. Like, so that's my issue. I feel like it's a lazy way to try and solve an engagement problem, which I think is vast. So that's why I posted about it. And yeah, like, I think there's lots of varied opinions. I think, some people will get offended that I don't think omnichannel should be a specific function because they see the value in it, which I also do. But then other people, I think, recognize the unmet need that we have within classic traditional brand teams, which is that it's not real marketing, in my opinion. It's kind of brand, what I would call brand marketing, like brand management. So yeah, that's like kind of why I focused on that topic. I don't know if Yasin, you have any views on those roles.
Absolutely, and I would also love to hear Amish's opinion, actually, even as a host. But to me, the omnichannel role should sit within the brand team and have common deliverables. Because I'm working on a post on this, but it's such a vast subject that even I'm stuck for now. So I'll try to share my thoughts, but they're not fully polished yet. But why should the omnichannel representative sit within the brand team? Because as you said, Dan, actually, we need to bring that expertise that sits within those teams classically and only to those teams. Because let's be honest, most of the marketeers that we have are usually people that transition from a sales function into a marketing function. Most of the sales reps, even though some of them have business acumen, also transition from a scientific role. We have a lot of pharmacists that actually become sales reps and then transition into a marketing role, but they don't necessarily have the expertise. And the moment they do have expertise, in any case, like in many industries and companies, if you're above average, then you get promoted to the next title and you lose actually that expertise within the team. But the accountability then of each person would be that the marketing responsible is responsible for the content and the messaging. Same for the medical representative, medical advisor, medical director, whoever it is that then sits within that team. But then the omnichannel person is the one that is responsible for making sure that that content uses then the right channel, if we want to go to channels anyways. And why is channel important? Because for me, channels do have a value, but more in the product lifecycle. For example, classical example, in your launch phase, you should do a lot of webinars. Why? Because webinars will allow you, one, to build brand awareness, but also if you do it right, and for me, it's a totally subject, achieve thought leadership. If you consistently for a very long time own a specific message, but webinars are lead generating activity. That's why you do them, to actually get the email addresses, build your first party mailing list, get insights on who was highly engaged, lowly engaged, etc. And even the interpretation then of the webinar data is something that in theory mostly or only sits with the webinar, omnichannel role. And so advising on the content and how we get that content to the HCP or in front of the HCP would then be the role, and the full team would be accountable for that. And then also setting the goals of, we create a specific deliverable, a specific output, a specific piece of content. Now I'm speaking in a global context. How many HCPs do we want to have exposed to that content? How are we going to measure it? And who's accountable for what part? Because that's where very often it falls off. If we again take the webinar example, who will invite people to that webinar? And then as a global function, usually we don't have a first party mailing list because the rights, even if people would register for that webinar, still sits with the local entity, or the local entity doesn't want us to communicate with those HCPs directly without them being aware. And so all of that then needs to be coordinated by the omnichannel role. And if we don't have that, it often falls into the gray zone. We know that gray zones tend to become black holes. No one takes accountability or responsibility. And we just pat ourselves on the back. Yeah, we delivered the webinar with this specific organization as medical. We're happy. We had our deliverable. We did great scientific output. No one watched it, but who cares? Because we don't even care about how many people watched it. From a marketing point of view, it's then a medically led activity. They don't really feel accountable. But that's why we need to, with common brand teams, common goals, need to break down the silos. I know it sounds a bit cheesy, the breaking down silos sentence. But as long as we don't achieve that, as long as we don't have 3 different functions being responsible for the same target and also being held accountable for that, for example, thorny subject through a bonus or to your individual targets, I don't think that will happen. And if your only goal as omnichannel or customer engagement lead is to build channels and making sure that emails are being sent, then we will not move the needle. And as said, the driver is we need to get that information to the HCP so they can make the most informed prescribing decision possible. So it's really a huge responsibility because there are people out there who live with a disease that cannot achieve remission, people that potentially die because they don't get the right treatment. And that's how we should look at this, because we have a huge responsibility as individuals working in this industry of getting this treatment in front of the right patient at the right time, to then do an analogy with the omnichannel definition. But Amish, I'm also curious about your opinion here.
Yeah, wow, so much to unpack between you guys there. So yeah, quite a few things. I think probably should have taken notes as you guys both were talking, but like I think the first thing was around like that channel aspect you guys covered. So I was thinking about that, and actually, I guess being in one of these roles and teams back when it was multi-channel, that was trending, and I think it still happens now. Is that because of that team be sitting separately, you do end up, it sounds like, and it definitely feels like it, you become a platforms team, like you said. And so whilst you've got those good intentions of helping the brand team as such orchestrate those customer journeys and plan a proper sequence, actually you end up kind of troubleshooting or putting things through channels, and like you mentioned, Dan, around like trying to get people to do simple email journeys, for example. Whereas actually, if you're maybe sitting in the team and the whole omni-channel role or the customer engagement role is maybe built around capability building, so building those skills on the job with the brand teams, I think maybe that's a better use of time. And the platforms, you shouldn't need local people in local countries to really look after platforms. Everyone in the company, every affiliate, every country, etc., is using pretty much the same platforms, and they should work. Everything should be set up in the same way. So they shouldn't need teams like that to do that. And so I think if we can switch those roles towards more capability building roles and embed them in the organization, then I think there is a place for these roles to make sense. So that's kind of one thing I was thinking. And then the other thing I was thinking, again, based on experience, was around like the budgets. So often, as we talked about, these omnichannel or customer engagement teams, for example, again, they're orchestrating or planning out these great great sequences for customers, yet actually they don't have any budget to do it or any power to influence really what the brand team ultimately does. And so whilst they can suggest these great things, spend their time looking at data and building all these things, actually the brand team will go and do what they're going to go and do because they've already committed their budget to something way in advance as well. So there are a couple of things I was thinking.
I think it's that, the thing for me is like the team, the way the team is built is like the team needs to have a goal. So if you're trying to achieve something, what team do you need within, like, working together day to day to achieve that goal? Instead of thinking we have these different departments and verticals and they're all responsible for different aspects across all brands. So, working on a particular therapy area or portfolio, or even one specific brand, is like, who do you need within that team? Okay. Like, probably, like, I would throw away the aspect of medical and marketing in this. I know, like, I'm just thinking of from scratch. If I was to think from scratch, who do I need in my team? For sure, I want someone deep medical knowledge on the topic, understands the therapy area, understands what trials are happening, what healthcare professional opinion is. I want that in there. Probably I want someone who is responsible for collecting and understanding insights on a regular basis. So whether that's from field teams, whether that's from data that we're getting from third party, or whether that's from CRM, just regularly feeding the team with knowledge and information about customers and how they're interacting. You're going to want someone who's got oversight of the marketing plan and the strategy. You're going to want someone who has the technical capability to brief in development, brief in agencies to run CRM integrations and things. And then does that, can one person cover multiple roles? Can one person do multiple things, or do you need a separate person for each? Maybe end up with a team of 5 or 6, depending on the size of the brand, and then those people can work together to deliver. And then centrally, you've got like a head of omnichannel who directly line manages each person within those team kind of vertically. But you're kind of like, you're starting to create teams that achieve objectives rather than people with roles and responsibilities. And I like, just culturally, it makes a big difference, because you're then a team working together with lots of different skills to achieve a common goal, instead of being a team that says like, well, I don't want to touch that because that's not my responsibility. So you end up with people basically, instead of trying to do more, you try to do less because you say, I can't do that. It's not my job. So pass it on. And then everything's disconnected. And as Yasin said, and as you guys said, like it's, we have a responsibility to invest in generating value and helping healthcare professionals and patients, if that's your role, to understand, receive education, and to understand where products can be used successfully. So for me, like that's why it's really important to try to, whether we call it break down silos or just actually create some like collaborative frameworks so that there's actually some team collaboration going on. I think that's important. And then the other thing on channels is like, just to build on Yasin's point on like webinars important early. Absolutely. Like, we need to stop thinking of our channels as these are the channels we have and we just use them at all times. Because that's what I see in tactical strategy and
Exactly.
the delivery. It's just like the same thing. But early in the life cycle, webinars, there's, whether could use webinars later on, but they might be about completely different things, like probably not really about the product or education. It's just to keep people engaged, maybe in conversation, and to just build trust with the brand. At that point later in the life cycle, it's more about brand awareness. And like some of the more traditional advertising becomes like really important, like just continuously showing people the brand and its association with the product and its patient type on your kind of traditional media buy websites, because then people are just consistently aware of that product and they associate it with the solution. And I just think what I see at the moment is people saying, well, webinars are good, so we should always use them, or banner ads are bad, so we don't use them. That's not true. It's just all about the context. And I think people need to remember that, what are you trying to achieve right now, and what does your customer want to achieve right now, and then marry those two things together. And that's you need to rethink that every year in your cycle, rather than just saying, we have more things that we want to tell everyone each cycle, so we're just going to deploy more things across the same channels every year. That's my view on the, like, probably the key things that need to change, like from a channel deployment perspective and a team collaboration perspective.